My name is Sophie Brown, and the article I'm presenting is entitled Strategies to Support Spirituality in Healthcare Communications. It's published in the Journal of Holistic Nursing, the official journal of the American Holistic Nurses Association, from the December 2014 edition. The authors included Dr. Maja Revlin from the University of Utah, Shirley Otis Green from the City of Hope National Medical Center, Dr. Lee Ellington, and Dr. Margaret F. Clayton from the University of Utah. Even though this study was drawn from a hospice environment, the strategies presented in the study can be applied to any healthcare setting when working with patients with a serious illness. No matter what health profession you're in or what you'll end up in, I think knowing your patient's spiritual and cultural background can help ensure quality healthcare. First, I will provide an overview of the study. Second, I will discuss the methods of the study and the results. Third, I will discuss the strengths and weaknesses. And lastly, I will conclude with my personal reaction and close with discussion questions. The study was a qualitative analysis of an auto-recorded interaction between a hospice nurse and a bereaved family immediately following the death of a family member. The National Cancer Institute supported the study, and the family's identities were changed to ensure confidentiality. The study was done to gain a better understanding of spirituality within a healthcare context, as well as to provide strategies for other healthcare professionals. The pilot program required nurses to wear a recorder for at least one of their hospice visits and to obtain consent from all that were involved. The method for the study involved an analysis of a single audio recorded session with a hospice nurse immediately following the death of the cancer patient. The interaction took place at the home of the late patient, his wife, and his 2 adult children. The goal of the visit was to remove the body from the home, but also to help the wife cope from her loss. Only one audio was used for this article because the nurse did an excellent job communicating supported spiritual care. At the beginning of the appointment, the wife, who is now a widow, had been his primary caretaker, and she was the one who showed significant distress from the loss of her husband. She did not want the body removed from the home at all, but the nurse applied meaning-based strategies to integrate spirituality to help the wife start her coping process. Please note the husband had been sick for some time, and there had been various hospice nurses visiting the home. The hospice nurses were familiar with the family, and they knew the family had a very strong spiritual connection. The study methodology had some limitations and weaknesses. The first limitation was that it couldn't be generalized because the sample was just too small to apply to the large population. The second limitation was the inability to make causal claims due to such a small sample. Despite analyzing one audio recording, the study has some strengths. First, the hospice nurse provided space for emotional expression, meaning she asked questions but paused long enough to allow the patient's family to speak freely. Second, the nurse maintained compassion and empathy throughout the entire visit. She had visited the family several times before to develop their relationship and gain insight into their culture and beliefs. With this knowledge, she was able to effectively communicate at the family's level. The last strength was the use of the meaning-based coping strategy. The meaning-based coping strategy is a technique used to help the patient find a positive meaning in a distressed situation. This essentially would help the patient start the coping process. Also, through active listening, the nurse was able to help the wife recall positive memories and watch for affirmation cues from the children. After reviewing the study, I came up with the following discussion questions. 1. Have you had experience applying spiritual care? If so, how did you address it and what was the outcome? 2. What other communication strategies or recommendations would you suggest as a training tool that was not mentioned in this article? 3. Does your current employer have a form of a spiritual care model or assessment in place? If so, do you find it effective? Why or why not? 4. Do you think spirituality is important in healthcare? Why or why not? To conclude, spirituality can be an important element when working with patients and families who uses their beliefs to cope with serious illnesses or death. Even though the study only analyzed a single recorded audio, the goal was to provide an example of a successful interaction as a training tool for nurses. Studies have shown that nurses who received training on how to incorporate spirituality felt more comfortable doing so. All healthcare professionals should be trained to perform a spiritual screening and have the ability to incorporate spirituality when needed. I hope you enjoyed my presentation, and I look forward to your feedback.